Opinion polls, less than half of the French population intends to get a COVID shot. Well, for more, we can speak to epidemiologist Catherine Hill. Thank you so much for speaking to us. What do you think is taking so long here in France?
Honestly, I have no idea. I see absolutely no reason. There must be the same number of shots per head as in Germany, because that's the way the union organized things. So I really do not understand why they are proceeding so slowly.
Isn't it rather complicated, though, logistically, to roll out the vaccine, not least because it needs to be stored in very specific conditions? Isn't that quite a major operation that requires careful planning?
It couldn't be so difficult. I mean, you need some special equipment to keep the vaccine, but you have the time to distribute it. It's not so, it can be moved from A to B easily with a thermos and liquid nitrogen. I don't see the problem, really.
Could part of the problem be the fact that so many French people are skeptical of this vaccine and other vaccines, and they don't want to be vaccinated? Is that part of the problem?
No, they could start by vaccinating whoever accepts to be vaccinated, and that's more than 140 in a few days. There are many people who are willing to be vaccinated. They should start by doing that.
Okay, so you haven't heard anything from the French government or from the authorities to explain why only 140 people have been vaccinated, and we're on, day 3 of the vaccination rollout?
Absolutely not. There is no explanation whatsoever. They just say they are being cautious, but what's that caution? What is it about? And there's been no explanations on how the vaccine has been studied, what to expect as side effects, sort of 2 days where many people will have fever, headaches, and a few problems. And there's no information. People are left in the dark.
Have you been vaccinated, or do you have a message to someone that might say they're afraid of being vaccinated?
If you are, you have to decide whether you want to be vaccinated or not. But this Pfizer vaccine, I've read the papers, I've read the FDA report. This vaccine has been very carefully studied and is very safe. And I trust Moderna vaccine is the same. And I haven't seen any data on the AstraZeneca vaccine, but I'm sure it's pretty much the same. Anyway, we need to review the evidence. The evidence has to be made available, and the government has to communicate on the data and to explain that how these vaccines are studied and how safe they are.
Okay, and of course, vaccines are just part of the strategy to eliminate the virus and for us to get back to our normal lives. But there's testing, and then, of course, containment measures. France under curfew. There's talk about the curfew being brought forward to earlier in the evening. What do you make of that plan? Will that help?
Not really. It will be. Those things have very marginal effects. The virus is circulating at a rather high level. There are about 400 deaths per day for now several weeks. And a curfew moved from 8 p.m. to 6 p.m. is not going to make a big difference.
Okay, well, thank you very much indeed for speaking to us, epidemiologist Catherine Hill.